because I don't want to cause a pneumothorax or puncture the heart. I don't want to stick a needle into my brain. I don't want to stick a needle into the ends of one of these long bones, because that's in a joint cavity, and now I could leak synovial fluid. Okay, so where are they going to go? A very painful procedure where they try to give deadening, but from the people that I've known, the deadening doesn't work, and it hurts like
It
pigeons.
really hurts.
So you've had this done.
Mhm.
So the pathologist now gets a sample of the reticular tissue and then looks at the development of the blood cells that are present there. Yes?
Mhm.
And makes a diagnosis. Okay, so that's red marrow, reticular. All right, now we also know that there are lymphoid tissues where blood cells are growing up all over your body. So you listed lymph nodes, spleen. There are several of these. Okay, so let's get a list of these where you might expect to see blood cell development. All right, so here they are, the lymphoid tissues where blood cell development occurs. Here's my list. Let's start at the top. Inside me, inside my mouth and nose, I have 3 sets of tonsils. They're all lymphoid tissues. They're part of the immune system. There are white blood cells there. All right, so as I move down into the thorax, the next major lymphoid organ is the thymus. An organ that sits on top of your heart that degenerates with age. It's a lymphoid tissue. White blood cell development there. Makes all kinds of important hormones for white blood cell development. All right, so as we work our way down from the thorax into the intestines, in the walls, let's see my histology people. I know a couple of you were in histo. That little girl right there was in there. Were you in histo? Chelsea, you were in there? Yeah, y'all should have nodded because now you busted. So if I'm looking at the walls of the digestive tract, everybody knows this, right? What epithelium am I likely to find there? In the wall. Non-ciliated, simple, columnar. That's in the middle. That's in the inside, okay? As I work my way out from there, the next layer, which is a little unusual, I work my way out from there. The next layer is a little bit unusual because I expected the middle to have smooth muscle in it. But in the gut, the next layer we call the submucosa. Now you've been introduced to that in this class already. What kind of tissue is that? Submucosa. It's the same tissue as dermis. It is an irregular arrangement of collagen. It's connective tissue, and we call it dense, irregular. Okay, there are some ways to go, yes? You need to be looking at this. So that should have come to you immediately. That's dense, irregular, submucosa. And now in that submucosa, histology students, as you work your way down through from the duodenum to the jejunum to the ileum, there is one major thing that will jump out at you in that submucosa as you get closer to the large intestine. Patches of lymphoid material that we call. You got it, Chelsea? That's it. Yes, Peyer's patches. Yes, remember those? So Peyer's patches present in the wall of the intestine. And it almost looks like when you get to the end of the small intestine, they blow out into an organ. And that organ is also filled with lymphatic tissue. What is that organ? The organ that the lymphoid tissue blows out of just as the large intestine begins. It's a worm-like structure attached to the cecum, sticking off of the large intestine. It's all lymphoid tissue. It's called the appendix, the vermiform or worm-like appendix that sticks off of the cecum. And then you mentioned spleen, so that's another one, the spleen. So those are all lymphoid tissues. And the final one you've mentioned to me already here today. Wherever you go in the body, you will find patches of lymph nodes. And there is blood cell development that happens there as well. So now you have a good working list, I can return to this, of hematopoietic tissue and lymphoid tissues. Okay, so that was all backwards and forwards, working off of the epiphysis of a long bone. Now, this is compact, okay? If you're going to talk about the marrow in a bone, you're not thinking about the compact portions of the bone. Notice how this is a smoothed out cartoon appearance here. Smoothed out, smoothed out. A very different appearance from this material here. And you can see on this slide here the differences. This is a smoothed out piece, and this looks cavernous. That's what the word trabeculae means, with cavernous. And so this kind of bone here, the outer portions of the bone, the bulk of the mass of the shaft of the bone, that stuff is this, compact bone. So when you look at the compact bone, this is what it looks like. And I'm not going to get into the details of the lamellae here yet. I want to talk about blood supply here on the next picture. But the purpose of this particular picture is to point out the strength of this bone. Compact bone is very strong. It looks like transverse sections of pine trees. Yeah, the concentric rings, the lamellae, make it look that way. And that is a very good illustration, actually, because the bone grows in that way as well, similar, at least in an analogy form to a pine tree. It grows in these concentric rings. And you can see how they are clustered together. There are columns of these pine trees in compact bone, making it very difficult to break it. It's a very strong bone. And you can see that compact bone makes up the bulk of the shaft of the bone, and it covers the edges and is created across the epiphyseal line. Compact bone, histologically. Now the marrow is found in these guys, in these holes, in the trabeculae. And this bone is called spongy bone. Now, don't go there yet. So spongy bone is where the marrow is found. And you will see different arrangements of this. For example, the skull bones, you know there's red marrow there now, there's hematopoietic tissue there, so you also are aware that there's spongy bone there. But that's what you mean. If there's marrow there, it's in the spongy bone. So is there spongy bone in the ends of the long bones? Well, sure, I just said that. What about the shaft? Spongy bone there? Yeah. It's just a proportional thing, right? The majority of the shaft of the bone is compact, but can you see the little holes here? So marrow is associated with spongy bone. The compact bone, you will not find marrow in the compact bone. It's in the spongy bone. Yellow marrow in the spongy bone of the shaft, red marrow in the spongy bone of the epiphysis. All right. Now, let's finish this with a little blood supply discussion. Here I got this one. And then we can return to this one more time. And I want to say something about calcium regulation too. Okay, so spongy and compact bone, red marrow, yellow marrow, identification of the various places where blood cell formation is occurring in the body. And now the last thing here is to compare the vascularization. So I use two examples with you when I introduce connective tissue. One poorly vascularized and one well vascularized. Cartilage and dermis. Now, at first appearance, if you pick up a bone, you think it's hard, it probably wouldn't have very good vascular supply. But you would be wrong. Bone is extremely well vascularized. So, before we're done, you're going to have to learn these things. I have it coming on the next presentation. You're going to have to learn how the blood supply and development gets into the Haversian canal, how it passes through the Volkmann's or perforating horizontal canals, and how the osteocytes receive nutrient through their canaliculi in an anatomy. So look ahead. And I'm going to come to it in lecture set 3, where I will teach you the specific anatomy. This is not the last time you're going to see bone. Today is introduce them to compact and spongy, talk about the big picture of what you find there, and the different bone types. Okay, now before we leave it, let's say a couple other things here. This says that the bones provide a site for calcium storage and other minerals. Now that's a very important observation. And again, things that you can never forget. Bones are an important calcium storage site. So your body has a number of very sophisticated mechanisms to regulate calcium ions in circulation. Bones are part of that. And so learn the 2 hormones now, and I'm going to give you a lot more in the spring on these 2 hormones, their receptors and how they work. Here they are, 2 hormones for bone. The first one is a thyroid hormone called calcitonin, C-A-L-C-I-T-O-N-I-N. Calcitonin is a hormone that promotes the storage of calcium in bones. Calcitonin is a thyroid hormone that is bone building. It promotes the storage of calcium. Its antagonist is made by the parathyroid glands, and it is called parathyroid hormone, commonly called PTH, parathyroid hormone. And parathyroid hormone will, in the absence of appropriate calcium levels, cause bone to be degraded, building plasma calcium levels. Now, I said that very carefully. I don't know if you noticed the words that I used there, precision of words. Because I know what's coming in your life, and we don't have time to do it today. But those are the 2 big ones, thyroid, calcitonin, and PTH from the parathyroid. Now, in clinical settings, PTH is oftentimes used for treatment of osteoporosis. And there's a good reason for that, because PTH can actually benefit bones with appropriate calcium levels. So see how you're getting yourself twisted in a knot now? It's okay. At this point, you got the 2 antagonist hormones within physiology. It's true. If your calcium levels fall to dangerously low levels, PTH will eat your bones. It's not good for you. It can be good for you if there's enough calcium around, but it is typically bad in an individual with low calcium levels. Okay, so we'll leave that. You have a question?
Why do you have to eat calcium in your whole life? I've always been taught that you just need it as a kid and realize that you need it as an adult and much too.
Yeah, so it gets more and more important, especially for females, because the loss of estradiol 17 beta, postmenopausal women, causes calcium storage problems. And so there are a lot of ladies that don't realize this is happening to them in their 50s. The PTH will begin to degrade the bones because their bodies are not absorbing as much calcium as they were before. They actually need more in their diet. So, and vitamin D is part of that story as well. The kidneys and the liver all play a role. But yes, it cannot be overemphasized, the importance of calcium in a person's diet. Extremely important. Okay, blood. So we worked our way from connective tissue proper. Are you done? Done? You done? Huh? Where are you going? It's just 9:50. Oh. All right, so we did connective tissue proper with the fibroblasts, and we did cartilage now with the chondroblasts and chondrocytes. And now we're going to talk about blood. Sorry, we did bone next. Missed the bone. The bone connective tissue we talked about. And I want to return to that. We're going to do the development as I promised you, as I'm getting you ready for the dissection. And then this one is the last one for the connective tissues. This is blood. So certainly hemocytoblast stem cells for blood. Now, the big hiccup that I find with students learning categories of connective tissue is really solved by the illustration I gave you in class on Monday, where you find that blood is a tissue when it's clotted. So if you're going to explain really to someone why it's considered a tissue, you can do it with the embryology part. All of it comes from mesenchymal germ layers. That's good. That's pretty good. But people really grasp bone as a tissue if they can touch it. It seems like it's a liquid. It's not a tissue. But it is a tissue because of the presence of a protein in the plasma. Does that sound familiar? So the matrix of blood is really plasma. And there are 3 major families of proteins dissolved in the plasma. One family, the biggest family, are called the albumins. Now, if I said there are 3 major proteins in the matrix, what would you have come up with? If there are 3 major proteins in the matrix of connective tissue, what would you have come up with? I've failed you. The big structural proteins of connective tissue. Can you name them? 2 of them at least. Collagen. Okay, fibronectin's one. Elastin's the other big fiber type, and yeah, the reticular fibers, which are really a form of collagen. Yes. Okay, so that's the way I would have described the big proteins that make up the consistency of a connective tissue. So there are in fact 3 big proteins that describe the consistency, really for our bodies, the osmotic capacity, right? Because blood, really the importance for blood is supplying nutrient to the tissues. You have to perfuse the tissues. You got to get stuff in and out of the capillaries. And it's really the proteins that direct all of that physiology. So there are 3 big proteins that you find in the plasma, in the matrix. I'm using that word on purpose. Nobody calls blood plasma matrix. But in our definition, it's cells, fibers, and matrix. That's a connective tissue, right? Okay, so cells, red blood cells, white blood cells, platelets, erythrocytes, leukocytes, thrombocytes. Plasma is water, but it's matrix outside the cells, right? There are proteins dissolved in it, and they are, in order, albumins, number 1, globulins, number 2, fibrinogen, number 3. These are the 3 dissolved plasma proteins that describe the matrix of blood. Yeah, it's water. That's true. And so we think about blood as being water. That's fine. But these 3 proteins describe its nature, its properties, its ability, its consistency, its touchability. All that are described by these proteins. And the big one is actually the least abundant. Fibrinogen is a protein dissolved in the blood that will come out of solution if you let it sit still in the form called fibrin. Fibrin is an insoluble protein. And it's ready at a moment's notice to come out of solution and form a clot. It's there already. All you got to do is just leave it sitting still somewhere. Put somebody in a bed for a long time, and they will form clots in their legs. Deep vein thromboses, DVTs, that cause all kinds of problems. They get loose, make an embolism, get in the lungs, make a pulmonary embolism, people die. So fibrin is the explanation in my mind of what you mean when you say blood is a tissue. Because when it's out of solution, it's tissue, touchable tissue. All right, now let's list the blood cells again. The cells that we find there are red blood cells, and they make up the bulk. More than 90% of the cell types in blood are red blood cells. They are a unique cell type in the human body in that they are unique in that they have no nucleus in their adult forms. There are no other cells in the human body like this. Now the numbers of these things in human circulation are mind-blowingly staggering. You have to use scientific notation to describe them. So generally a person will have about 3 to 5 million of these cells in a cubic millimeter of blood. A millimeter is about the width of a fingernail. So a box, 1 millimeter by 1 millimeter by 1 millimeter, that's almost too small to see, will contain 3 to 5 million of these. You see what I mean by staggering numbers. Much lower in number are the white blood cells, or the leukocytes, and there typically you find about 6,000 to 8,000 of these in a cubic millimeter. This is a very useful piece of information clinically. If the white blood cell count is lower than 6,000, you have a problem. If the white blood cell count is higher than 8 or 10,000, you got a problem. Right. So that normally is, this is the one that everybody knows about, because that means you're fighting an infection if those numbers are high. And there are a limited number of types of these white blood cells. And I like to teach students, because most people are supposed to take 300 level classes first and then 400 level. I like to teach students some very easy tips on how to identify the white blood cell types whenever I get to this point in the semester. But I've only got 3 minutes left in class, and that's not enough time to do that. So as I begin class on Wednesday of next week, I'm going to give you some very easy tips on how to identify neutrophils, eosinophils, basophils, lymphocytes, and monocytes. You can give me a right stain material blood, and I can pick them out like that. Not science. I have to learn science to do it. Just a little trick about each one. I have these tips in my head as to how to do this. And so I like to give those to the anatomy class. It would have been useful, right, before you got to histo? Okay, so I give those tips out for the rest of you. Take Dr. Du Bois histo next year or in the spring or something. You'll be ready to go whenever you start identifying white blood cells. Okay, so that's where we'll start, with the blood cells on Wednesday of next week. Please do not forget that you have a bone histology exam next Friday. I'm just about done with the histo. The muscles and nerves don't take hardly any time at all. Once I get past blood, it's like falling off the log. That's really the end of the horrific detail. I'll go through skeletal, cardiac, and smooth, and the neuron stuff is just an intro, because we're going to do chapter after chapter of innervation, neuron sizes and shapes and all that stuff. So this is really the end of the big push in the histo, is the blood, and the muscles and nerve stuff for histology section here will go very quickly. And then, let me tell you what's happening. From then to the point where you're going to take test 1 will be my effort to familiarize you with the terminologies. So I want to tear a muscle down. We've pretty much torn a bone down, but I'm going to do it again. Tear a muscle down, tear a bone down, and talk about the terminology that has to be used with muscles and with bones, and then ultimately with nerves. So you're going to get a short introduction to muscles, bones, joints, and nerves, and blood vessels. Because I have to use those terms over and over and over again from the outset, right, Taylor? We're going to start with the supraorbital foramen. Take the frontalis off. We'll start right there, right at the top of the head, and immediately you're going to have nerves and blood vessels and muscles and tendons and bones. So you have to be familiar with all that terminology for me to do that. So when I get into that, it's going to be test 1. And then test 2 begins here. And we work our way down. All right.
Stop it.